In just a matter of months, healthcare exchanges will be open for business in New York. Chances are you might not know a whole lot about them since they're still being developed under the Healthcare Reform Act. But depending on where you work, you may be forced to join one. Jennifer Lukey is joining us now live in the newsroom with the real deal on just how they work and also what you should be doing now to prepare for them. Hi, Jen.
Hey, Dory, the Affordable Health Care Act is forcing changes that may soon take the middleman, or in this case, your benefits department at work, right out of the equation when it comes to choosing your health care plan. Those of you who work for a small business with less than 50 employees may be transitioned into a health care exchange in this coming year. In many cases, employers will still contribute to the cost of your health care, but you're going to have to do a lot more work than you're probably used to.
Essentially, if you choose or are forced into a healthcare exchange, you'll go online, put in your coverage needs and wants, and
the exchange will spit out information to you to show you the number of health plans that are available to you that might fit your needs, and you'll be able to shop and compare individual health plans on that basis.
But chances are you won't get any better of a price on premiums.
A consumer will probably see more benefits on the exchange than they did in years past. I'm not so sure they're going to see lower costs.
Basically, the exchanges make it a bit easier for the employers, but for the consumers, well, it'll be the opposite.
The employer could say you're going to get $250 a week. Here's access to the portal, here's access to the different plans. Pick the plan that's right for you and your family, and here's how much we're going to contribute, and you can contribute all or the rest.
Keith Dolan has spent the last few years counseling businesses on changes under the Affordable Health Care Law. Many small local companies are deciding right now what exactly to offer employees, if anything, next year.
It's great to have a choice, but then they need to understand what the differences are within those choices.
If you're not offered insurance through your work or you decide not to buy into an exchange, starting next year you'll be penalized financially by the feds. But the fines can be cheaper than the insurance, and that may cause a problem down the road.
Our concern still remains that the young invincibles, those 28, 29, 30-year-olds who don't have real health needs, won't join, and instead will opt to pay the penalty,
causing an unbalanced risk pool that'll drive up prices.
So right now, all of the details of these exchanges are still being worked out. If your employer transitions to an exchange, they're obligated to give you a lot of information about it and help walk you through the process. Dory?
I'm sure there will be no shortage of that information, but time's ticking here. When exactly do these healthcare exchanges open up?
Well, officially they open in October, but the end of July, though, the insurance companies will roll out all of the plans that will be part of these exchanges for us to get a closer look at them, the cost, what they'll offer. Now, of course, we will continue to follow all of these changes and bring you much more as we get closer to the dates of implementation.
All right. Thank you very much, Jen. We will stay on top of it. Thanks so much. Greg?
Also